Hello, today I'm going to speak about the treatment of chronic hip pain problems. This is very important message and it's really vital for patients and for physicians to know exactly what is the cause of hip pain problem and then to decide what type of treatment that can be offered. So I have spoken in the last few videos about the chronic pain in the hip, what is the causes, what is the differential diagnosis, how to find out the previous from the previous history of the patient and from examination if this is pure arthritic hip pain problems or it is a referred pain from other part of the body. So today I'm going to speak specific about the hip arthritis, and in fact the treatment start from a very basic treatment which is over-the-counter pain medications. This could be some non-steroidal anti-inflammatory drugs like such as ibuprofen or other medications such as paracetamol. And if these medications does not help, then the patient need to seek the advice of the physiotherapy, because stretching exercises in the hip can improve significantly the hip pain problems. However, if the exercises did not help, then the patient need to seek further medical advice, and this can be through either orthopedic surgeon or through the chronic pain consultant. So when I see the patient with hip pain problems, the first step is to start the conservative management. This management is usually, as I mentioned, non-steroidal medications and paracetamol. Then we can escalate the treatment according to the cause of the hip pain problems. If the patient is eligible to have hip replacement surgery, then I will seek an advice of orthopedic surgeon to find out if the patient arthritic problem is so significant, hence he will need a surgery or not. Of course, a preliminary x-ray of the hip will be done, and this is to find out what is the degree of damage in the joint. Sometimes the patients either they are very young, like in their 40s and 50s, hence they are not eligible yet for hip replacement surgery. And sometimes they are either having morbid obesity or having significant other comorbidities such as heart problem, severe other conditions such as diabetes with high blood pressure, with or cancer, or any of these problems that render them ineligible for a hip replacement surgery. So in this specific situation, pain medications and pain interventions will be extremely helpful. Why? Because actually the young patients can postpone the need of the surgery. The normal hip surgery can last on average about 15 years. So if we delay the need for the surgery as much as possible, then actually the patient will get benefit from the artificial hip. On the other side, after hip surgery itself, sometimes the patient present with actually pain in the hip, and it is really difficult situation because the patient think that after the surgery there will be no issue in terms of pain problems. Unfortunately, sometimes there is residual pain problems and there is a degree of failure in the hip operation. This scenario is very common if the patient has a revision of total hip replacement, and the more revisions that is done, the more chronic pain the patient will be left. So my advice is to take the opinion of both the orthopedic surgeon and the chronic pain consultant as well, because between the two physicians, the patient will get the best advice regarding whether he will need a revision of hip surgery or not. So if the patient has, say, hip surgery and he is still in pain, struggling, the best thing at this stage is to do actually we can do radiofrequency ablation of the articular branches of the hip. And this treatment include RFA for the obturator branches and for the femoral branches as well. So the innervation of the hip is a complex one. The position of the needle under X-ray while the patient is in supine position will be one needle just under the anterolateral aspect of the hip socket, and this is just inferior to the anterior inferior iliac spine. The other needle will be placed just below the teardrop, and this is in connection between the pubic bone and the ischial bone. So in these two places we can do sensory and motor testing before we do the ablation, because in fact we do not want to affect the motor branches from the obturator and femoral nerves. It will be worth actually doing a diagnostic injection before having the actual ablation. Of course, if we go straight for pulsed radiofrequency treatment with block, there is no harm because we are not doing any ablation here, and this can actually be a test in the same time, so we can find out if the block plus the PRF did help or not. As you know, the PRF is usually 42 degrees and it's for around 4 minutes lesion. So this is if the patient already had hip replacement surgery. Also, if the patient has hip replacement surgery and still having hip pain problems, we can as well offer him psoas compartment block or DRG for the 3 lumbar nerve roots that give the nerve supply to the hip. And this will, in my view, I did like a big number of patients, and the psoas compartment block with PRF or block only can actually give significant improvement, and I nearly have 100% success with this procedure, provided that it's done under X-ray guidance and it's done with a contrast, and it is with a nerve stimulator, so you do everything correct and you make sure that you are hitting the correct lumbar plexus. On the other hand, if the patient has no hip replacement surgery, it's actually easier to treat because we have the original joint, so we can target this with the steroid initially. If it doesn't work, we can use plasma-rich platelets in the joint, and this actually achieves the regeneration of the joint cells, and it has a very good result. Next step will be, in my view, either to do either hyaluronic acid or a mixture of hyaluronic with plasma-rich platelets. Again, I do it under ultrasound, or I prefer actually X-ray because I can see with the contrast that it's spreading into the joint. And then the last step will be the radiofrequency ablation for the articular branches. If the pain is coming not from the hip itself at all, but it's a referred pain from the facet joint arthritis, which is a back joint. Once you treat the facet joint arthritis by radiofrequency ablation, then you are okay and the hip pain will disappear. I hope you found this video to be helpful. If you want to know more about the joint pain problems and how to treat them, please follow me and subscribe to my channel. Next time I'm going to speak about the shoulder pain problem and how to treat it. Please subscribe to my channel, Chronic Pain Solutions, and if you want to get a consultation with me or to ask about any question, you can visit my website, which is www.paintreatment.ie. Also, I am existing on the Facebook, and it is a chronic pain consultant in Galway. My clinic is in the Galway clinic, and you are very welcome to contact me through the website if you have any query. Thank you very much, and see you next time.